Having the right people in your corner for life's biggest milestones makes all the difference. Like a friend who's there when you're house hunting or checking out a new ride, State Farm is there too, helping you choose the coverage you need. With a State Farm agent, you know someone is there to help you along the way. And with so many coverage options, it's nice knowing you have help choosing a plan that fits your needs, so you can continue celebrating all of life's milestones. Like a good neighbor, State Farm is there.
Saturday presents, in the red corner, the undisputed, undefeated Weed Whacker Guy. Champion of hurling grass and pollen everywhere. And in the blue corner, the challenger, extra strength Saturday. Eye drops that work all day to prevent the release of histamines that cause itchy allergy eyes. And the winner by knockout is Saturday. Saturday, bring it on.
With so much information being discovered about our health on a daily basis, it's hard even for doctors to keep up. The answers might be hiding in an obscure medical journal that a physician doesn't have the time to go searching through. A frustrating situation for both them and their patients. It's an issue that Dr. Andrew Tagg has been trying to combat since 2013 when he co-founded Don't Forget the Bubbles. It's a website that removes the obstacles of finding and sharing resources between physicians.
We knew that we were working in disparate sites, and we got asked all these questions all the time at work that we just couldn't find the answers to in textbooks. And, we know that textbooks are 5 years out of date by the time they come out. And we thought, well, let's just try and collate our resources. And that's what we did. And our mission really is to make doctors and healthcare workers better at looking after the kids that they see on a daily basis. So we're a physician-facing website rather than a parent and patient-facing website. And our aim is to share both latest research and some of the tips and tricks about the art of medicine as well as the science of what we do.
Tagg is a pediatric emergency physician and associate professor at the University of Melbourne. Even though the site is geared towards healthcare professionals, Tagg says it's important that every article is written so that you don't need a medical degree to understand it.
What we like to do is to make sure we're writing in plain English rather than medical journalese, which is a problem because we want to cater for, our junior trainees as well, who may not be so used to critical appraisal of the literature. And we want to make things that actually are practical rather than just going to sit in a dusty journal and never ignored all the time.
Though the website's been active since 2013, the team fell into the global spotlight for an experiment they did just a few years ago. Born from an issue they see often in their young patients, Tagg and his colleagues decided to each swallow one Lego head.
I'm a pediatrician, and we wanted to see how long it would take, because we get these kids coming with swallowing foreign bodies all the time, and we wanted to see how long it would take to pass through kids. And we obviously couldn't get ethics approval to get our own children to swallow it, so myself and 5 colleagues swallowed a Lego head.
They each timed how long it took for the Lego piece to go through the body. The answer? 1.7 days. The study was covered by various news outlets across the world and even broke into a couple late-night talk show monologues. As silly as it sounds, it became a helpful tool to comfort parents who'd rushed their kids into the emergency department for swallowing a piece of plastic. And if you've been around kids, you know that's not the only trouble they can get up to. Another common issue Tagg deals with is having to fish out foreign objects from inside a patient's ear. Often, the culprit is the end of a Q-tip.
So people put them in, twizzle with their ears, and then, the end will break off for whatever reason, and they'll be stuck in there. And so, they've come in they started off with one problem, or at least one alleged problem, their earwax, and they come in then with an ear Q-tip stuck in their ear.
People are often trying their hardest to get rid of earwax, not realizing how essential it is to our health. Many of us don't even know what all that goo is in the first place. Despite its name, earwax isn't really wax at all.
Earwax is really this big mulching, messy pot of lots of different things. So it's skin cells, it's sebum, which is kind of that oil that's produced by your skin that we all have. Little bits of hair and glitter that have come in from, errant craft sort of exposures. Occasionally, little bits of insect leg, I've seen those in there as well. But really, it's just a natural thing that your ear canal produces as a protective mechanism.
For one, it acts as a physical barrier, catching anything trying to get inside your ear canal, like dust and dirt.
But it also acts as a mild antimicrobial barrier to stop things getting into the ear. And it's very slightly acidic, so it really just helps stop bacteria that lurk around on our skin all the time, getting into any sort of minor cuts or scrapes that we might have in our ears.
Earwax also serves as a lubricant. It coats the sides of the ear canal and prevents the skin from becoming dry and itchy. It's also this moisturizing property that allows it to naturally clean out the canal.
What we've got to remember is that our skin sheds on a daily basis. And if the skin in our ear just kind of stayed and sloughed off, it's just going to sit there with this big ball of dry, flaky skin in our ear. And so it's got to collect with something. And often it's with that earwax. And there's this thing, basically an escalator, a travelator of hairs inside your ear that waft that earwax and that dry skin slowly from the inside to the outside. And that'll just help it just pass out naturally.
And just like the rest of our body, our earwax has evolved over time. Some researchers think that as humans began to migrate to more extreme climates around 70,000 years ago, a genetic mutation occurred. Today, there are two types of earwax, wet and dry. Whichever variation you have is dependent on one singular gene.
And so you'll find that there's a group of populations, so East Asian and Asian and African often have this sort of dry, flaky earwax that comes out. And those of us of European descent and Celtic descent are much more likely to have that sort of wet, dark, brown, gunky earwax that, which just kind of has that funny, weird smell to it.
Whether you have wet or dry earwax, both serve the same purpose and are a crucial component of our ear health. And though millions of people love watching ear cleaning videos online, Tagg says a clean ear is not a wax-free ear. In fact, removing all of your earwax will actually compromise your health.
We do get people come in and try and, think, oh my God, I see this earwax in my kid's ear. I'm going to scrape it all out with a curette or a Q-tip. And actually, it's there for a purpose. And scraping it out causes more wax to be produced because it's part of the sort of inflammatory response. So if I stick a Q-tip in your ear and I do that on a regular basis, or a matchstick or a paperclip or, the end of a pen, whatever people are trying to use, over time, what will happen is your body will react to that sort of foreign stimulus and slowly, slowly narrow your ear canal. So, this is over years and years and years. And so what will happen is you'll be more prone to getting ear infections, more prone to getting swimmer's ear and water trout if you continue to clean them all the time.
Narrowed ear canals make it harder for earwax to flow naturally, leading to buildup, ear infections, and temporary hearing loss. Along with using Q-tips, a practice called ear candling has grown in popularity over the last few years. A person will lay on their side and put the end of a long candle in their ear. The candle is then lit for 20 minutes. The idea is that the warmth from the lit candle creates suction that pulls wax out of the ear.
But that's not what's happening. Nothing is happening. Anything that comes out that you pull out is actually just melted wax from the candle. So you may think, and which is why most earwax candles are the same color as earwax, because then you'll never know. Because, if your earwax candles were bright red or purple, you'd soon know there was some sort of scam going on there. But no, waste of time.
And again, most people doing it don't need to be cleaning out their ears. In general, Tagg says the only time you'd need to see a professional is if you're experiencing hearing problems. A glob of hard earwax can push against the eardrum and cause pain, dizziness, and muffled hearing.
And so if you're a child that's, not paying attention in class slowly over time and then finding it really difficult to concentrate, or, you're shouting at them and they're not just a teenager staring at their phone and they're ignoring you, then that may be because they're actually having hearing difficulties rather than attention difficulties. And so it's one of those simple tests that, your primary care provider could do just to make sure that that's not the cause of what's going on. And if they see a big hard ball of impacted wax, and that's often that sort of dark, thick, brown, sticky stuff that's been pushed against the eardrum because people have been cleaning, they're probably going to need some professional help.
Additionally, impacted earwax can also be the cause behind a chronic cough.
Impacted wax can basically compress on your drum and compress on one of your nerves in your middle ear that's attached to your vagus nerve. And that vagus nerve is that sort of longest nerve in the body that we always talk about when talking about breathing and calming down and everything else. But the vagus nerve can also make you cough. And so that in the same way that sometimes, don't try this at home, if you put something in your ear and it touches your eardrum, it can make you cough in the same way. A hard ball of wax can cause that sort of chronic daily cough.
The good news is that many of these cases are fixable at home. While there are softening drops you can buy at the store, Tagg says the cheapest and most effective treatment he's found is using warm olive oil.
And I think really what that'll do is a seromonolytic, so it breaks down that earwax. And if you put that in, bathe that in your ear 3 or 4 times over the course of a week, it'll really soften that wax and it'll then make it easier for it to come out naturally. You can buy over-the-counter stuff, which often also breaks down wax, but not often as effective. And I think the first thing that people notice as soon as they start putting drops in their ears is they come into us because they think, oh, I had earwax, I put some drops in, and now I can't hear anything. And that's really as that sort of wax starts to soften up, it expands, fills the ear canal, and then you get a sort of temporary deafness. That, again, disappears over time.
Which means some patience is required for this process. If you do need to see a professional, the best treatment is a microsuction, which is basically a small vacuum that sucks out the impacted wax. If you're interested in more unique health tips and tricks, Tagg's website is don'tforgetthebubbles.com. For more information about Dr. Andrew Tagg and all of our guests, visit ingoodhealthpodcast.org. For more behind the scenes, follow In Good Health Podcast on Facebook, Instagram, and X. Our writer-producer is Kristen Farrah. Our production manager is Jason Dickey. I'm Greg Johnson.
Did you hear that? Out here, the most dangerous enemies are never heard. Our sensors detect the faintest signals below the waves, stopping enemies long before they can surface. Leidos, outsmart, outdo.
We know life is busy. That's why saving money should be effortless. With Atlantic Union Bank's Roundup Savings, every time you use your debit card, your purchase rounds up to the nearest dollar and automatically goes into savings. So whether you're grabbing coffee, filling the tank, or picking up groceries, you're saving without even thinking about it. It's just one of the ways Atlantic Union Bank makes managing your money easy. Learn more at AtlanticUnionBank.com or stop by a branch today. Atlantic Union Bank. Any way you bank.